We're live?
Yes.
Alright. Hey everybody. So we're gonna be yeah, and then have them.
Nobody's yet there.
Let's do it. Alright. Hey everybody. So we're just going live today, and we're gonna be talking today about mostly IV therapy and some of the vitamins and things like that that we offer. So we are gonna be going live here, usually on Fridays around 5 o'clock. So you guys can always join us, ask us any questions you have, whether it's related to that week's topic or anything in general. We're mainly going to be talking about IV therapy today, but we're definitely going to be talking about other stuff too. So if you guys have questions about anything, even if it's not related to IV therapy, just let us know and we'll make sure to answer them. So IV vitamin therapy is basically if you guys have ever had an IV when you're in the hospital or for any other reason, it's the same kind of process. We connect the IV to one of the main veins in the arm, but instead of just giving you fluids, we actually do mix a lot of different vitamins and minerals in the fluids. So it's a great way to get an extra boost of vitamins and minerals. And which vitamins we use specifically is going to depend on which IV we're doing and for what reason we're doing it. So all that stuff plays a role. So some of our most commonly used vitamins are things like vitamin C, the B vitamins, B1, B2, B3, B5, B6, B12. We also magnesium, calcium, and a few other stuff. So thanks for everybody who's just joining us right now. Again, we're just talking about IV vitamin therapy today, but feel free to ask questions about anything you want. So we'll kind of start with some of the commonly questions that you guys sent us throughout the week about IV vitamins, and then basically how often should I get an IV is one of the first questions. So how often you should get an IV, again, is going to be based on which IV we're doing. Like I said, things with vitamin C and the B vitamins are the most commonly done ones. So people, what are some of the reasons people are getting IV? It's basically to help them stay hydrated, to get that extra boost of vitamins. Vitamin C plays key roles in immunity, so that's very important. B vitamins play roles in energy and the nervous system health and all that stuff. So just staying healthy, staying sharp and all that stuff. Magnesium, calcium, vitamins and minerals are so essential to everything we do, whether it's our sleep, our breathing, again, our mental abilities, as well as our just mental well-being, as well as our physical well-being. So all that stuff is very, very important. The vitamin B 12 also plays a role in energy, so we do a lot of vitamin B12 shots on its own too for people who want energy, but also helps with absorption of other vitamins, and with many other key things, even liver health and staying healthy and detoxed. So so if you guys have any questions, again, specific to IV or outside IVs, please feel free to ask us. So somebody's asking, I hate shots, is IV vitamin therapy okay for me? And yeah, I mean, most people don't like shots, so it is common that people don't like shots. With the IV, it can be easier for some people because it's just that initial shot to get to the vein. So there is one initial shot, but honestly, especially if you have a good vein, it's so easy and quick. And then after that, you just don't feel anything. You just feel like fluid running down up your arm. So it's really very easy and straightforward. And again, it's a great way to get vitamins. Another common question is, can I just take vitamins from my nutrition, from my food? And you definitely want to try to eat a healthy and diverse diet to get as much vitamins and nutrition from your diet as possible. That being said, unfortunately, most of us don't get enough vitamins from our diets. Most of us don't get enough nutrition from our diet, and that's because of a few things. Most of us actually don't eat enough vegetables and whole foods as we should. Unfortunately, we many times we go for fast food and things like that, which might not have as much nutrition. And it's even the food, even when you eat vegetables and fruits, a lot of times the food now is deficient. It doesn't have as much vitamins and minerals as it used to be. So there's deficiency of essential nutrition in the food itself, and we're not getting enough of the food sometimes too. So we have another question here, and it's asking if there's a mix that might be used for fibromyalgia or for like youth blend or something like that. And there's some stuff that can be used. So for example, magnesium tends to be very helpful, nutrition for a lot of people with fibromyalgia and for people with asthma, for people with headaches. So there are definitely, we customize the vitamins and minerals here, and there are certainly certain things that we can add to kind of address certain conditions a little bit more, whether it's fibromyalgia. We do have an IV Skin and Beauty is I think what we call it here, and it's basically, it has certain trace elements and trace minerals which are also very essential. We use glutathione, which is a very powerful antioxidant for the skin, and it helps keep that youthful look. So there's definitely some different combinations that can be done based on whatever that person is looking for. What's the next question we have here about IV vitamin therapy?
What shots do you offer?
What shots do we offer? So yes, a lot of times people who don't want to start an IV, they can get many vitamins through the shots. You can get everything through the shots, but the main ones are B12. We do MIC shots, which is sometimes known as a skinny shot or a lipotrophic shot. And that's usually, the reason we call it that is because it helps, support the person's metabolism. So it's great for people who work, for athletes, or honestly for anybody who's trying to lose weight and they're trying to eat healthy and diet and exercise, but they just kind of want like support of a shot to also help with that. But we can also do the glutathione, which is that powerful antioxidant I was talking about. We can do that as a shot too. The B12, I think I already mentioned. We can really do all the B vitamins as shots. So whether it's B1, B2, B3, B5, B6. Those are the main ones that we do here as shots. And there's a couple more, I'm pretty sure.
When can I get an appointment for IV therapy?
Yeah, I think we do our IVs here usually on Tuesdays, Thursdays, and Fridays. So you can call the office whenever you like, or even send us a DM here, and then we'll and then you can schedule an appointment. The IV vitamin therapy appointment usually takes about 45 minutes to an hour. First time you're here, there's some paperwork, so it might be a little bit longer, but usually sometimes even within 30 minutes, depending on each client. So somewhere between 30 to 45 minutes, I guess, would be the average time it takes for an IV. But it's great, really. There's no downtime. There's not much that you have to worry about before and after. You just come in, drink some water, come in, we start the IV. You sit there on your phone for 45 minutes or so, and then the IV is done, and you feel great afterward.
Are there any side effects?
Are there any side effects? Was the next question. Honestly, IV therapy is very, overall very safe treatment. What we're doing is basically IV fluids plus vitamins, and We always ask to see what medications you're taking, if you have any allergies, because these are all vitamins that you've been, exposed to your whole life. It's very rare to have like an allergic reaction, for example. Nobody's gonna be, no one's gonna be like allergic to these vitamins. It's very rare to have like something like an allergy for something like that. Sometimes people get a little bruise when we start the IV. Sometimes we have something like superficial thrombophlebitis can happen where there's a little bruise of the vein. But again, that's not really that common and it's easily treatable if it happens. But other than that, it's pretty safe. When you're sitting there, you'll just feel kind of fluid, cold sensation running up your arm. Sometimes you feel a little bit of a vitamin or a metal mineral taste underneath your tongue as the IV is running. So these are the common things that we see, and it really doesn't bother most people. So they're pretty safe.
Who benefits most from IV treatments?
So the question is, who would benefit most from IV treatment? And it's honestly for everybody. I mean, here we do it for anybody 18 and over can do it, but usually anyone who wants more vitamins and nutrition in their system can use it. Now, like I said, there's different mixes, so it can be more specific and more kind of directed for different people. So for example, we have athletes who come in, and then in that case we'd add amino acids to the mix to help support muscle growth. Sometimes people are feeling a little bit under the weather, and then we add more vitamin C to help with the immunity. So really anyone can benefit, but especially people, if you're having like a bad week, there's more stress from work, and you just kind of wanted the extra boost of energy, then it's probably a great time to come in, get an IV.
Somebody's asking, can pregnant women receive IV therapy?
So we can do something basic. So usually that is usually one of the safe treatments, because we do avoid, most of our treatments when someone's pregnant. But if someone wants to do, if someone's pregnant and just wants, a basic IV fluid, that should be fine. That there's no contraindication there. There might be certain vitamins and things that we might not include. So it is one of the few treatments that actually is 100% safe, and we do it all the time for people with pregnancy. And then we have,
how can I find out if my body is vitamin B12 deficient?
so how can you see, the question is, how can you find out if your body is vitamin B12 deficient? And there are lab tests that can be done. So we can test that. We can test for that. We can send it for lab. That being said, vitamin B12 is safe even at high levels that are way higher than what most people have. So we can, if we are concerned about vitamin B12 deficiency, we can definitely test for that, send it to lab. But a lot of times we don't need to even do that if we can kind of treat it symptomatically, because we know even if we go to higher levels of normal, it's still very safe. And in fact, a lot of times with some of these vitamins, we are trying to reach higher levels of normal, because a lot of times with these vitamins, the normal range is very wide, and being low normal might not feel the same as being mid normal or high normal. And sometimes being high normal has additional benefits, whereas if you fell in the kind of lower end of the range, you might still be considered normal, but you might be missing out on some of the benefits that you can get if you got your levels a little bit higher. And plus you gotta consider that that's the range for the whole population, and everybody's different. Everybody has different requirements, so that's why sometimes kind of the lower range, a number in the lower range might be okay for somebody else, but for that certain client or certain patient or certain condition, it might not be enough.
Somebody's asking, is there an IV treatment that includes vitamin D?
We can do vitamin D as an IV. It's typically kind of a little bit more special. So there are certain vitamins, mainly vitamin A, D, E, and K, which we do, with these vitamins, we do want to get your levels before we do. So for vitamin D IV, we do need to know exactly what your levels are, because for that one, we have to be way more specific. So in the previous examples, I was kind of referring to things more like vitamin B12 and vitamin C, where if you get to the very high range, then it's still okay. But there are vitamin A, vitamin D, vitamin E, and vitamin K can be very, are actually what we call fat soluble vitamins, so they can be stored in the body. So when we administer these vitamins, we want to know what your levels exactly are to know exactly how much we can administer and not. But if you usually want it, you want it to come in and not worry about doing lab work, and just want it to kind of do a quick, or not quick, but you just want to do like a general IV for well-being. That one generally include more things like vitamin C, B vitamins, calcium, magnesium, these kind of nutritional minerals, but not vitamin D. And then we have...
I don't know if you want to touch a little bit. I know that our clinic is offering free B12 shots to teachers and school staff. So I don't know if you wanted to just let everybody know.
Yeah, and I know there was a post on the Instagram too. So anybody, I guess, working in school staff or teachers, they are there's complimentary B12 shots that are being offered here. And I think, what are the dates again? From February 18th to March 1. So you can just call in and make an appointment then. The phone number here is 661-222-9117, and I know obviously it's on our Instagram post, so it's definitely something that that can happen.
Somebody has a question that's a little off topic, but since we have you here, I just wanted to...
The eyebrow.
I
can read it.
That. Okay.
So the question is, if someone's watching that later and can read the comment. It says, my eyebrow fell on 2 occasions after Botox with 2 different dermatologists. What happens and why? And that is something that can commonly happen. Now, some of the reason so Botox relaxes the muscle, and whenever we do the forehead specifically, we are dealing with the muscles that raise your eyebrows. So a lot of times, if there's too much imbalanced Botox there, it can cause the eyebrows to droop. So it is a common problem. There are definitely things that we do to avoid that issue. I don't know what happened specifically in your case, but I can tell you one of the most common reasons that happens is if the Botox is based a little bit too low, where it's too close to the eyebrow, it can affect these muscles and cause that unwanted droopiness. The other reason is when we look at the forehead muscle, the forehead lines, we always see these wrinkles, but there's also the glabella, which is what causes the 11 line wrinkles. The thing is, some people have wrinkles in both places, some people have it in one place, but the 2 muscles are imbalanced. So a lot of times, if we just treat the forehead muscles without putting some Botox in the glabella or the 11 line, or if we put more in the, even if we treat both, but if we don't keep it balanced, if we put a lot more in the forehead, for example, that can throw off the balance and the muscles can overcompensate and bring the eyebrows down. So in other words, you always want to make sure that you stay high when you do the forehead muscles, the frontalis muscles, and you also want to make sure that you're always also treating the glabella and keeping these 2 muscles in mind when you do the treatment. And this usually really helps decrease the risk of the droopy eyebrows, because when that balance is when these 2 muscles are thrown off balance, that's when these issues tend to happen more often. And sometimes we see it more often if someone has like smaller forehead, for example, because there isn't as much room. So sometimes in a hurry, people don't see it and they go a little bit down because there isn't as much room. So you always want to stay above, and you want to make sure you treat this muscle as well, and that tends to solve it in many different places. And we have another, I think, question here about Botox. And that one's asking about the Botox areas. So somebody asked about
COVID. Oh, never mind.
yeah. Someone was asking about like Botox and how many units, and again, that's gonna vary from person to person. There are many different areas where we can do Botox. The kind of most commonly done area is the glabella, or what we call the 11 line, or sometimes the frown line, and sometimes you'll get kind of two lines here, and when you do that angry face, that's the most commonly done muscles, and we usually do maybe 20 units in there. Could be less, could be more, depending on the person. Most commonly done area is the forehead, and these are the two muscles I was just talking about being imbalanced, the glabella and the forehead. And you can, a lot of times we do the glabella without doing the forehead, and that's absolutely fine. But it's the thing you want to watch out for is you don't want to do the forehead without doing the glabella, because that's when you start having issues. And then the third commonly done area is the crow's feet, which are kind of, sometimes we call them the smile lines, when people are smiling and all that stuff.
Somebody's asking about IV therapy. Sorry, and then IV therapy and having it done during COVID. How effective is it?
Yeah, I mean, those are it's a lot of vitamins. I mean, vitamins are important for in general, for your general well-being. Whether it's during COVID or outside of COVID, I think it's still a good idea. Honestly, it's not like it's not something that's gonna make a huge difference. There are a lot more people now who are kind of more conscious of their immunity, because of COVID, and they want to make sure. And it is a great time to make sure you eat healthy. I mean, like I always say, you want to make sure you're eating healthy to keep your body healthy. Anytime, whether there's something like COVID going on or whether there isn't, you want to make sure you're getting enough nutrition from your food. You're getting enough exercise. You're eating enough fruits and vegetables, and you're doing whatever else you need to do to make sure that you're on top shape. And whether that is getting supplements from IV shots or IV vitamins, that should be honestly the case all the time. And with the COVID, I know people are more conscious of it, as they should be. And a lot of people are trying to kind of pay more attention to their health, which is a good thing. So hopefully, the COVID pandemic is getting closer to an end. Hopefully there's some, light at the end of the tunnel now. But, even when this thing is over, we should always kind of pay attention to our health, pay attention to what we do, the food we eat, the exercise we do, and whatever else that needs to be done in addition to that, to just supplement that, and again make sure that we're taking care of our bodies. And that's kind of what the IV vitamins are meant to do. They're not meant to replace eating right and doing everything right, but they're just meant as supplements to ensure that you are getting all the additional vitamins, because unfortunately, as I said, most of us do not get enough vitamins and minerals from our food and from our diet. I wish that wasn't the case. I wish we were all getting all the vitamins we need from our food, but the reality is we aren't. And that's why having something like an IV vitamin therapy or shots when we need them can be very, very beneficial.
Someone's asking, how often should I get the vitamin B12 shot?
Sure. So how often you should get the vitamin B12 shots? Again, the answer is going to vary from person to person. I'll give you some kind of general recommendation, but everybody's a little bit different. We can check your vitamin B12 level to see how deficient you are. That will play a role. The type of diet you're eating will play a role, because sometimes people, like vegetarians, for example, might not be getting enough vitamin B12 from their diet. A lot of people we put them on a program where they might get it like more often initially, just kind of like as a loading phase, where we might do it even once a week for maybe 3 or 4 weeks, and then after that we'd spread it out further. So again, everybody's different, but generally it might be once a week, 3 or 4 shots, and then after that we spread it to kind of more closer to like once every 2 weeks or once every month, again depending on what that person usually eats and how much vitamin B12 we think they're getting from their own diet.
I think that's it. Maybe just touch on the fact that we're just, if anybody's new in the room, about we're offering the complimentary B12 shots to the teachers here at our clinic. So.
And I think we have the post too. So guys, make sure you check out the post we have on Instagram. But there's some information on there. The clinic is offering free complimentary B12 shots for teachers and school staff. Yeah. And so, you know, we also want to take the time to thank you guys, you know, all the teacher out there. It's been tough for everybody, but especially for you guys, and you know, being able to accommodate the kids and, you know, learning, and it's been crazy for everybody. So thank you guys for doing that. I think we're about to close, so we're gonna be here again next Friday, and again it's gonna be a different topic each time, but you can always ask us any questions you have, whether it's on topic or off topic. That's no problem. And also, if you guys have any suggestions or there's something specific that you want us to talk about next week, just, you know, send it to us. So if you guys want us to kind of focus more on, you know, fillers, for example, or joint injections, or PRP hair, which is another thing we can talk about next time too. We didn't talk enough about just for thinning hair and hair restoration. So if there's any specific topics you guys want us to address next time, just send us a DM and we'll make sure to address it. And if you guys have any questions for next time that you want us to address in the live, you can also ask us. That's why we have so many questions, so you guys can DM us throughout the week with any questions you have, and we'll make sure to get back to you, but also address it in the live. Thank you, everybody, and you guys have a great day.